Hi, I'm Dr. Bill Cushing, and today I'd like to talk to you about healthcare reform and show you that there's a simpler solution to healthcare reform than we've been led to believe, at least led to believe by our government. Now, to do that, I'm going to have to list facts that we're going to have to accept as reality. And if we accept these facts as reality, we can produce a solution. The first fact is Obamacare's failure is inevitable. The second fact is that healthcare reform is needed to address this impending failure. The third fact is that healthcare reform has been promised to us by the new Trump administration. The fourth fact is that Medicaid is managed well by most states in association with managed care companies, in partnership with managed care companies. 5, Medicare also functions well in association with managed care companies. A successful example would be Medicare Advantage, a very successful partnership between Medicare and private insurers. 6, healthcare reform cannot be sustained without reducing costs and sustaining these cost reductions. 7, cost reductions will reduce the quality of care, at least initially in the short term. 8, defensive medicine costs are a very significant part of healthcare costs. 9, pharmaceutical costs, drug costs, are higher domestically when compared to other countries, and in many cases, much higher. And 10, we have to accept this fact. There is no cheap way for a nation to finance health care for its citizens. You can't do this on the cheap. Now, if we accept those 10 factors, we can come up with a solution. So I recommend that we, 1, address defensive medicine costs with medical malpractice tort reform. I have previously written about this, and I will give you a link that justifies medical malpractice tort reform and actually produces a solution that is reasonable. 2, we should increase Medicaid availability to those under 65 years of age without a means test. That's right, without a means test. This will also address the pre-existing condition issue. 3, increase Medicaid block grant funding to states and allow them to manage Medicaid without the need to constantly seek waivers for Medicaid management changes to procedures and standards. 4, for those who opt out of this Medicaid option, they can purchase health insurance from the private marketplace. But it will be their choice. It will be their cost. There will be no premium support for the purchase of insurance on the private marketplace. 5, we must increase Medicare and Medicaid fraud control. For anyone who has worked with Medicare and Medicaid, they know that fraud exists. 6, we must reduce Medicare reimbursement rates for hospital-based care. Hospital reimbursement rates are too high. 7, we must reduce the burden of regulations on the primary care community so that it is possible for primary care physicians to re-enter private practice. This will increase the delivery of care, reduce the cost of effective care, and over time produce better healthcare outcomes and quality for patients. And finally, 8, start negotiating for pharmaceutical cost reductions in every sector of healthcare. I am a family doc, a family physician, a healthcare attorney, and former entrepreneur with many years of experience. I like to keep things simple and use what is readily available to me when solving problems. It appears that the present administration and Congress are making mistakes similar to those of the Obama administration. The Trump administration and Congress are listening to present and former elite academics, think tanks, and organized medicine to come up with a solution that is more complex than it needs to be. The same mistake that the Obama administration made. Let the states be the payer for healthcare delivery to their citizens under 65 years of age. They will do a much better job managing costs than the federal government. They have the Medicaid experience. They have the Medicaid infrastructure in place. This approach will address many of the healthcare reform problems that exist today, will limit the administration's exposure to failure, and, more importantly, produce a palatable solution for U.S. citizens. Isn't that the most important thing? Well, thank you. I hope this helps. Have a good day.